The price of knowing less. There are many ways for a superpower to announce confidence. Withdrawing from the institutions it helped design is an unusual one. President Donald Trump's decision to remove the United States from the World Health Organization is being presented, as so many such decisions are, as an assertion of sovereignty. America, the argument goes, will no longer outsource its judgment, tolerate bureaucratic incompetence, or subsidize international bodies that appear ungrateful, inefficient, or ideologically suspect. The gesture is meant to convey strength, independence regained, entanglement severed, autonomy restored. It represents something far less muscular. It is not an act of dominance but of deliberate blindness, a wager that ignorance can be substituted for control. And that disengagement can be mistaken for safety. In public health, such wagers rarely fail loudly at first. They fail quietly. And then, eventually, expensively, the misunderstanding at the core, the argument for withdrawal rests on a conceptual error so basic it is almost impressive. It assumes that global health cooperation is a form of altruism, a charitable impulse indulged by wealthy nations to assist poorer ones, admirable in times of abundance but dispensable when domestic politics demand spectacle. This has never been true. American participation in the World Health Organization was not born of humanitarian sentimentality. It emerged from post-war realism. Disease, unlike ideology, does not respect borders. Pathogens do not file visas. Bacteria are indifferent to sovereignty. Viruses are unimpressed by campaign slogans. The WHO was created not to make the world fairer, but to make outbreaks visible sooner, ideally before they reached airports, supply chains, hospital wards, and election cycles. Its function has always been informational first, moral second. It exists to aggregate signals, compare anomalies, verify reports, and coordinate responses that no single nation, however wealthy, can assemble alone. This arrangement was never about generosity. It was about early warning. Leaving the WHO does not make America freer. It makes it slower. How protection actually works. Public health security does not resemble national defense in the way politicians prefer. There are no borders to fortify, no walls to fund, no enemies to deter through posture alone. Instead, there are surveillance networks, laboratory reporting chains, genomic databases, and notification protocols, systems whose value lies precisely in their dullness. When they function well, nothing happens. When they fail, everything does. The WHO operates as a clearinghouse for this informational ecosystem. It collects data from national ministries, academic institutions, and regional surveillance hubs. It triangulates outbreaks, flags unusual patterns, and circulates alerts that allow countries to prepare before the threat becomes visible domestically. Participation is not passive. Countries contribute data and receive context. They gain access not merely to raw information, but to interpretation, what matters, what is anomalous, what may be noise, and what may become tomorrow's crisis. Surveillance only works when everyone participates. A sensor removed creates a blind spot. A blind spot becomes a delay. A delay becomes widespread. Withdrawal does not eliminate risk. It delays awareness of it, the illusion of self-sufficiency. Supporters of disengagement often argue that the United States can replicate these functions internally, that its centers for disease control and prevention, its intelligence agencies, and its biomedical sector are sufficient substitutes for multilateral coordination. This is a comforting fantasy. No nation, regardless of resources, can independently monitor outbreaks occurring in rural provinces, fragile states, conflict zones, or under-resourced health systems. The relevant data does not arrive through embassies or satellites. It emerges from clinics, laboratories, and local surveillance networks embedded within countries that may lack the incentive, or capacity, to report rapidly without institutional frameworks already in place. The WHO's value lies precisely in operating where bilateral reach ends. It standardizes reporting. It builds trust relationships. It provides technical support that makes surveillance possible in the first place. Without those systems, outbreaks are not prevented. They are merely discovered later, often when they have already escaped containment. the idea that America can replace this architecture on its own misunderstands scale. It is akin to believing one can recreate global weather forecasting by staring more intently at the sky. Influence is not automatic. Another casualty of withdrawal is influence, though this is rarely acknowledged by those advocating it. International institutions do not obey by default. They are shaped by presence. Rules are written by those who remain in the room. Standards reflect those who argue for them consistently, not those who boycott theatrically. For decades, the United States used its position within the WHO to push for scientific rigor, transparency, and evidence-based norms. It was often frustrating. It was occasionally outvoted. It was sometimes disappointing. That is the nature of institutions designed to include every government on Earth, but influence is not measured by comfort. It is measured by outcomes over time. Outside the system, American leverage disappears entirely. The WHO will not cease to exist. Its committees will still convene. Its guidelines will still be drafted. Its standards will still shape global procurement, regulation, and response. The difference is that America will no longer help write them. Power vacuums are not moral spaces. They are simply occupied by others. The economic dimension nobody mentions. Public debate tends to frame global health spending as philanthropy, money flowing outward with little return. In fact, it has been among the most economically rational investments Washington has ever made. By stabilizing health systems abroad, the WHO reduces the frequency and severity of disruptions that ripple through trade, manufacturing, and logistics. Pandemics are not merely medical events, they are macroeconomic shocks. Ports close. Labor disappears. Supply chains fracture. Markets panic. Preventing those shocks, or detecting them early enough to mitigate damage, protects American jobs as surely as any tariff or subsidy. The WHO also underpins global standards for medical products, diagnostics, and vaccines. Its pre-qualification processes help determine which technologies are accepted in international markets. American pharmaceutical and biotechnology firms benefit directly when those standards are transparent, science-based, and globally recognized. Participation ensures compatibility. Withdrawal introduces friction. In a world where regulatory alignment determines market access, stepping away from standard-setting bodies is an odd way to promote competitiveness. Reform versus abandonment. Criticism of the WHO is not without merit. Its early handling of COVID-19 revealed structural weaknesses, political sensitivities, and bureaucratic inertia. Information was delayed. Deference was excessive. Transparency was uneven. These failures deserve scrutiny, but scrutiny is different from abandonment. Institutions do not improve when those most capable of reforming them depart. Walking away does not fix dysfunction, it merely removes pressure to change. It leaves the same machinery operating, only with fewer voices demanding accountability. Reform requires presence. Leverage requires participation. Influence requires endurance. Disengagement achieves none of these. It confuses protest with power. The pathogens waiting patiently. Public health threats do not pause for ideological debates. Influenza continues to evolve. Antimicrobial resistance advances incrementally each year. Novel pathogens circulate quietly at the margins of surveillance systems. These threats are not dramatic until suddenly they are. The danger lies not in what is visible, but in what goes unseen. The mutation sequenced, the cluster unreported, the signal dismissed as noise because the system connecting it to others no longer exists. The WHO's role is not to prevent every outbreak. That would be impossible. Its role is to shorten the time between emergence and recognition. Withdrawal lengthens that interval. And time, in epidemiology, is the most valuable commodity of all. Who pays first? When global health coordination weakens, the first costs are borne far from Washington. Children miss routine vaccinations. Surveillance programs lapse. Clinics lose technical support. Outbreaks that might have been contained early expand quietly. These are humanitarian tragedies, to be sure. But they are also warning flares. Those failures do not remain isolated. They spread geographically and temporally. They move along migration routes, trade corridors, and airline schedules. What begins as a local lapse becomes a regional outbreak, and then, eventually, an international emergency. Decades of American investment in global health were designed precisely to prevent such chains of failure from forming. Withdrawing from the WHO does not save money. It merely defers costs, and increases them. The irony of protectionism without protection. The administration's worldview treats international cooperation as a zero-sum contest, one in which any benefit to others must represent a loss to America. Public health defies this logic. A safer world does not weaken national security, it strengthens it. Stronger disease surveillance abroad reduces domestic vulnerability. Shared standards reduce chaos. Predictable coordination prevents panic. This is not idealism. It is systems engineering. The irony is that the very voters promised greater protection may now receive less, not immediately. Not visibly, but gradually, invisibly, until preparedness erodes, and response becomes reactive rather than anticipatory. Public health disasters rarely arrive with announcements. They accumulate in silence. The cost of being last to know. The most dangerous consequence of withdrawal is not what it removes, but what it delays. Without embedded access to global surveillance, the United States risks becoming the last major power to know when the next threat emerges. Information will still circulate, among those who remain connected. It will simply reach Washington later, filtered through secondary channels, incomplete and behind events. In crises, being second is unfortunate. Being last is fatal. This is not a hypothetical risk. It is the predictable outcome of disengagement from systems designed specifically to ensure early awareness. In exchange for symbolic defiance, the country trades foresight, a familiar pattern. The decision fits a broader pattern. Institutions are treated as inconveniences rather than instruments, cooperation as weakness rather than leverage, and complexity as conspiracy rather than reality. It is an approach that flatters instinct and punishes expertise. It simplifies governance at the cost of effectiveness. The problem is that pathogens do not respond to messaging. They respond only to biology, probability, and time. Those variables are not impressed by bravado. The quiet reckoning, the most unsettling aspect of leaving the World Health Organization, is not what happens next week or next month. It is what happens later, when an outbreak is detected a little too late, when coordination is slightly slower, when response is fractionally less coherent. Public health failures do not resemble explosions. They resemble absences, missing data, delayed alerts, unanswered questions. By the time the consequences become visible, the opportunity to prevent them has already passed. The WHO has saved millions of lives not because it is perfect, but because it reduces uncertainty. It turns chaos into information quickly enough for action to matter. That protection does not disappear noisily when funding is withdrawn, it simply fades, and when it is gone, what remains is the bill, measured not only in dollars, but in days lost, systems overwhelmed, and lives that might otherwise have been spared. For a nation obsessed with strength, choosing to know less about the dangers approaching it is a curious strategy. It is not courage, it is willful vulnerability, dressed, as usual, in the language of independence.